Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. If you are over 60, this video could literally save your life because heart attacks don't always happen in hospitals. They don't always come with warning, and many occur when a person is completely alone. The most dangerous myth is believing a heart attack always feels dramatic. In reality, after 60, heart attacks are often silent, subtle, and delayed. And that's exactly why they're deadly. Let's start with the science. A heart attack occurs when blood flow to part of the heart muscle is blocked, usually by a clot. Within 5 minutes, heart cells begin to die. By 30 minutes, permanent damage occurs. Time is muscle, and muscle is life. After the age of 60, the most dangerous heart attack is not the one that feels dramatic, it's the one that feels ordinary. The one that whispers instead of screams, because science shows that nearly half of all heart attacks in older adults do not begin with crushing chest pain. They begin with subtle signals the body sends when heart muscle is already being deprived of oxygen. And by the time pain appears, irreversible damage may already be underway, because heart cells begin to die within minutes. And unlike skin or muscle, heart tissue does not regenerate. It scars, it weakens, and it silently shortens life expectancy. And this is why recognizing the early signs is not just helpful, it is life-saving. In adults over 60, the nervous system processes pain differently. Arterial stiffness changes pressure sensation, and long-term inflammation dulls warning signals, which is why fatigue becomes one of the earliest red flags, a sudden wave of exhaustion that feels out of proportion to activity, the kind that makes the body feel heavy and the mind foggy. And studies published in cardiology journals show that unexplained fatigue can appear days or even weeks before a major cardiac event, especially in seniors because the heart is already struggling to deliver oxygen efficiently. Then there is shortness of breath, not gasping, not dramatic, just a subtle sense that breathing feels harder than it should. Because when coronary arteries narrow, oxygen delivery drops, lactic acid builds up in heart tissue, and the brain responds by increasing respiratory drive, a survival mechanism that many mistake for anxiety or aging lungs. Sweating is another warning sign that is often ignored. Sudden cold sweats without heat or exertion caused by activation of the sympathetic nervous system as the body senses internal distress, a primitive alarm response that dates back to our earliest biology. And yet many older adults dismiss it as hot flashes, humidity, or stress. Nausea and indigestion-like discomfort are especially dangerous symptoms because they masquerade as harmless digestive issues, but research shows that the heart and stomach share neural pathways. So when the heart is in trouble, the brain may misinterpret the signal as gastrointestinal distress, leading people to reach for antacids instead of a phone, losing precious time while heart muscle suffocates. Pain in the jaw, neck, shoulders, or upper back is another silent signal because heart pain is referred pain, meaning the brain projects distress to other regions served by the same nerves. And in seniors, this referred pain is often more pronounced than chest pain itself, especially in women who statistically are more likely to experience atypical symptoms and more likely to delay seeking care, a delay that studies show increases mortality significantly. Dizziness or lightheadedness may appear as blood pressure drops when the heart cannot pump effectively, reducing cerebral blood flow. And this is not weakness, it is physics. It is circulation failing under stress, and ignoring it can lead to collapse, loss of consciousness, or sudden cardiac death. What makes these symptoms especially lethal is not their severity, but their subtlety. Because the brain is wired to normalize gradual change, to rationalize discomfort, to say, this is aging, this is stress, this will pass, but the heart does not negotiate with denial. And data from emergency departments worldwide show that older adults often arrive hours later than younger patients with more extensive heart damage, not because help wasn't available, but because warning signs were misunderstood. This delay has consequences that last a lifetime: reduced ejection fraction, chronic heart failure, reduced mobility, cognitive decline due to reduced cerebral perfusion, and a dramatically higher risk of future cardiac events, all because early signals were missed. The shocking truth is that survival rates increase dramatically when heart attacks are treated early, because modern medicine can reopen blocked arteries, dissolve clots, restore blood flow, and limit damage. But these tools are only effective when time is respected, and time begins the moment the body sends its first signal. Recognizing these signals is not about fear, it is about literacy, learning the language of your own physiology, understanding that the heart rarely fails without warning, but it often warns in a voice we are not taught to hear. This is why education is power, because when someone knows that sudden fatigue is not normal, that unexplained breathlessness is not aging, that nausea can be cardiac, that sweating can be an alarm, they act faster, and acting faster saves muscle, saves function, saves independence. The science is clear. The earlier the intervention, the smaller the infarct size, the better the recovery, the longer and stronger the life afterward. And this is not theory. It is measured in imaging scans, blood markers, and survival curves. For seniors living alone, this knowledge becomes even more critical because there is no second set of eyes to notice pallor, no voice to say something isn't right, only awareness and action. The heart is resilient, but it is not forgiving, and it does not wait for certainty. It responds to urgency, which is why recognizing early symptoms and treating them as medical emergencies is not overreacting. It is respecting biology. If there is one message to remember, it is this: heart attacks after 60 often arrive quietly, disguised as everyday discomforts, but the body is speaking. And those who learn to listen give themselves the greatest chance not just to survive, but to live well after. When a heart attack begins, the greatest enemy is not pain, it is hesitation, because science shows that the difference between walking out of a hospital and living with permanent heart failure often comes down to minutes, not hours, and yet most people lose those minutes to panic, denial, or the false belief that staying still and waiting it out is safer than acting, when in reality, immediate and calm action is what preserves heart muscle and keeps the heart alive. The moment coronary blood flow is reduced, heart cells begin to suffocate, deprived of oxygen and nutrients they need to generate energy, and within 5 minutes, those cells begin a process of irreversible injury, a cascade that accelerates with every passing second, because the heart has one of the highest oxygen demands of any organ in the body. This is why calling emergency services immediately is not a suggestion. It is a physiological necessity, because paramedics bring the hospital to you, oxygen to reduce myocardial stress, medications to slow clot formation, electrical monitoring to detect lethal rhythms, and rapid transport to facilities capable of reopening blocked arteries. And studies consistently show that patients who arrive by ambulance receive life-saving treatment faster than those who self-transport. Panic, however, works against survival because fear floods the bloodstream with adrenaline and cortisol, hormones designed for short bursts of action, not for a heart already struggling to pump. And this hormonal surge raises heart rate, blood pressure, and oxygen demand at the exact moment the heart can least afford it, turning a manageable event into a catastrophic one. This is why controlled breathing matters more than most people realize, because slow, deep breaths stimulate the vagus nerve, shifting the body out of fight or flight mode and into a calmer parasympathetic state, reducing heart rate and stabilizing blood pressure, a response so powerful that it is used clinically to manage arrhythmias and stress-induced cardiac strain. Sitting upright rather than lying flat is another deceptively simple action with profound physiological impact, because an upright position reduces venous return to the heart, decreasing preload and lowering the workload on a failing pump, while also improving lung expansion and oxygen exchange, which is why emergency responders instinctively position cardiac patients this way. One of the most misunderstood yet evidence-backed emergency actions is chewing a regular aspirin when appropriate and previously advised by a physician, because aspirin works by inhibiting platelet aggregation, slowing the growth of the clot that is choking off blood flow, and chewing it accelerates absorption into the bloodstream, a step shown in large-scale studies to significantly reduce mortality during acute coronary events, not by eliminating the heart attack, but by buying time until definitive treatment can be delivered. Time is the central theme of survival, because modern cardiology has remarkable tools: clot-dissolving drugs, balloon angioplasty, stents, advanced monitoring, but their effectiveness declines sharply the longer treatment is delayed, a phenomenon cardiologists call the time to reperfusion curve, which shows that every 30-minute delay increases the risk of death and heart failure. Staying calm also preserves electrical stability in the heart, because stress hormones increase the likelihood of dangerous arrhythmias, irregular heartbeats that can stop circulation entirely, and sudden cardiac death is often not caused by the blockage itself, but by chaotic electrical activity triggered by stress and oxygen deprivation. Unlocking doors and making the environment accessible may sound trivial, but it has life or death implications, because emergency response times are measured in minutes, and any obstacle that delays entry can mean additional heart muscle lost, additional scarring, additional loss of function that no medication can reverse. What is shocking is how many deaths occur not because treatment was unavailable, but because action was delayed by uncertainty, the human tendency to wait for certainty before acting, even when the cost of waiting is permanent damage. And research in behavioral medicine shows that people who recognize symptoms but delay care often do so because they fear embarrassment or false alarm more than they fear the heart attack itself. Calm, decisive action rewrites that outcome because it shifts the timeline, and shifting the timeline changes the biology, limiting infarct size, preserving ejection fraction, maintaining the heart's ability to supply the brain and body with blood, which directly affects mobility, cognition, independence, and lifespan after the event. Survivors who receive rapid treatment are more likely to return to normal activities, less likely to develop chronic heart failure, and less likely to experience depression and cognitive decline linked to reduced cardiac output, outcomes that are not abstract statistics, but lived realities for millions of seniors worldwide. The science is unforgiving but empowering, because it tells us that while we cannot control when a blockage forms, we can control how we respond, and that response determines whether the heart heals or scars, whether life continues with strength or with limitation. Fast action is not reckless, it is informed. Calm action is not passive, it is strategic. And together they form the most powerful survival tool available outside a hospital. The heart does not need heroics in those moments. It needs oxygen, reduced stress, and rapid medical intervention. And those needs are met not by waiting, but by acting with clarity. Understanding this transforms fear into readiness, because readiness replaces panic with purpose, and purpose saves lives. If there is one truth that science repeats over and over, it is this: the heart can survive a heart attack, but only if we respect time, control fear, and act immediately, because in cardiac emergencies, calm speed is not just helpful, it is everything. A heart attack does not begin the day it strikes. It begins years earlier, silently, invisibly, inside the walls of the arteries, because long before pain, long before warning signs, long before emergency calls, the body is already keeping score of every habit, every meal, every spike in blood sugar, every night of poor sleep, and every moment of chronic stress. And science now confirms that survival during a cardiac event is heavily influenced by how the heart was treated long before the crisis ever arrived. After the age of 60, the heart becomes less forgiving, arteries stiffen, endothelial function declines, and the margin for error narrows, which is why daily habits are not lifestyle choices anymore. They are survival strategies. Research shows that atherosclerosis, the buildup of plaque inside arteries, can begin decades before symptoms appear, and by the time a heart attack occurs, the blockage is often the final result of years of inflammation, oxidative stress, and metabolic imbalance, meaning that what you do every day either feeds the fire or puts it out. One of the most powerful predictors of heart attacks after 60 is chronic inflammation, a low-grade, persistent immune response driven largely by diet, insulin resistance, and visceral fat, and studies reveal that inflammatory markers like C-reactive protein are often elevated years before a cardiac event, silently damaging blood vessels and making plaques more unstable and more likely to rupture. This is where food becomes medicine or poison, because diets high in refined sugar and ultra-processed carbohydrates trigger repeated insulin spikes. And insulin is not just a blood sugar hormone, it is a growth signal that promotes fat storage, inflammation, and arterial damage when chronically elevated, which is why adults with insulin resistance are at dramatically higher risk of heart attacks, even if their cholesterol appears normal. Fiber-rich foods, on the other hand, slow glucose absorption, stabilize insulin levels, and feed beneficial gut bacteria that produce short-chain fatty acids, compounds shown to reduce systemic inflammation and improve vascular health. A connection so strong that researchers now consider the gut microbiome a key player in heart disease. Blood flow is another silent determinant of survival because healthy arteries are flexible, responsive, and capable of delivering oxygen efficiently, while diseased arteries are stiff, narrow, and prone to spasm. And one of the most shocking discoveries in cardiovascular science is the role of nitric oxide, a gas produced by the endothelium that tells blood vessels when to relax. As we age, nitric oxide production declines sharply, but certain foods like leafy greens, beets, garlic, and citrus fruits provide nitrates and polyphenols that restore this pathway, improving circulation, lowering blood pressure, and reducing the workload on the heart, effects that have been documented in both population studies and controlled clinical trials. Omega-3 fatty acids play a similarly critical role because they integrate into cell membranes, reducing inflammation, stabilizing heart rhythm, and lowering triglycerides. And populations with higher omega-3 intake consistently show lower rates of sudden cardiac death, a finding so robust that cardiology guidelines now recognize their protective effect. Magnesium, often overlooked, is essential for electrical stability in the heart, and deficiency is common in older adults due to poor absorption and medication use. Yet low magnesium levels are associated with arrhythmias, hypertension, and increased risk of heart attacks, meaning that daily intake from foods like seeds, legumes, and greens is not optional, it is protective. Movement is another form of medicine because the heart is a muscle that responds to use, and regular physical activity improves insulin sensitivity, increases nitric oxide production, enhances mitochondrial efficiency, and lowers resting heart rate, adaptations that make the heart more resilient under stress, and even modest activity like walking has been shown to significantly reduce cardiovascular mortality in seniors. Sleep, often underestimated, is when the heart repairs itself because during deep sleep, blood pressure drops, inflammation decreases, and hormonal balance is restored, while chronic sleep deprivation keeps stress hormones elevated, damages blood vessels, and doubles the risk of heart disease, a risk that compounds with age. Stress itself is not just psychological, it is biological, because chronic stress keeps the sympathetic nervous system activated, raising heart rate and blood pressure, promoting inflammation, and increasing clotting tendency, which is why practices that calm the nervous system, such as slow breathing, social connection, and mindfulness, are now recognized as legitimate cardiovascular interventions, not soft lifestyle advice. What is rarely discussed is that these daily habits do more than prevent heart attacks. They determine how the heart responds if one occurs, because a heart that is well nourished, well oxygenated, metabolically flexible, and electrically stable is more likely to survive an ischemic event with less damage, better recovery, and preserved function. Imaging studies show that individuals with better baseline cardiovascular health experience smaller infarct sizes and faster recovery even when blockages occur, meaning prevention does not just reduce risk, it improves outcomes. This reframes survival as a long-term process, not a single moment of heroism, because the real work of survival happens quietly, in kitchens, on walking paths, during sleep, and in moments of daily choice. The most shocking truth is not that heart attacks happen. It is that many are predictable, not in timing, but in trajectory, following patterns of metabolic dysfunction and inflammation that can be altered long before crisis strikes. When seniors understand that every balanced meal supports arterial health, every walk improves circulation, every good night's sleep lowers inflammation, and every moment of calm protects the heart's rhythm, fear is replaced with agency. This is not about perfection, it is about consistency, because the heart responds to patterns, not isolated efforts, and over time, those patterns shape resilience. Survival is not just about what you do when your heart is under attack. It is about how you live when it is not, because the habits you build today become the strength your heart relies on tomorrow. Science does not promise immortality, but it offers something just as powerful, the ability to stack the odds in your favor, to age with a heart that is stronger, steadier, and more capable of surviving the unexpected. And that is not hope, that is evidence.